Welcome back, everybody. So the Care Work Campaign and the National Coalition of Social Services have written to the Department of Social Development warning the lack of funding and neglect will cause yet another Life Esidimeni tragedy. Their report indicates that dozens of old age homes as well as children's homes and women's shelters across the country are on the verge of collapse as they have not received their subsidies from the Department of Social Development for the past 4 months. This in the midst of the coronavirus pandemic and an increase in gender-based violence. The report also indicates subsidies have been cut in many of the provinces and employees are using their own money to buy PPE for their organizations. Now, the struggles at homes are also massive in terms of feeding the elderly. The Department of Social Development told Morning Live that they have received the report and had established a committee to look into it, and that provinces who cut subsidies without explanation have committed to pay by the end of August. Let's get more detail on this now. We're joined by Lisa Vetten from the Care Work Campaign and Mervin Rossouw, who is from Seringa Association for the Aged. Both of you, thanks for joining us. It's good to have you on the program.
Thanks, Leanne.
Lisa,
Thank you.
Thanks, Mervin. Lisa, let me begin with you. Tell us a little bit about the collapse of old age homes and orphanages as well as women's shelters. Basically paint a picture of the dire consequences because of what we're seeing, or that you're saying, is the Department of Social Development has failed to give them subsidies for the last 4 months.
I think we have to distinguish between the National Department of Social Development, which is responsible for policy, and the provincial departments of social development. And the provinces are where the problem is based. So we have particularly dire problems in Eastern Cape and Northwest. They are now heading into their 5th month without payment. We have cuts in subsidies in Limpopo and Mpumalanga, as well as Eastern Cape and Northwest. We have Free State, Western Cape and Northern Cape doing what they should do, and Gauteng sort of doing what it's supposed to do. So the picture of crisis is really, I think, as you start to suggest, we have a situation where staff who have themselves not been paid are trying to buy food for their the residents in their shelters and in their homes. Sometimes they don't have money. They're relying on family members and friends in order to help out. Some are advertising and putting appeals on Facebook asking for help. Some have been asking for food parcels as well. In some instances, because staff haven't been paid, they're now in a position where it's extremely difficult for them to come to work because they can no longer afford transport. Organizations have borrowed so much money in both Northwest and Eastern Cape in order to be able to stay afloat that they have extended the maximum overdraft and loan facilities that they possibly can take. So I think there's very, very deep concern that what are they going to do next? Yeah. And I think if you have people in your care, you simply can't go and dump them on the pavement and say to the Department of Social Development, that's your problem now. That would be deeply, deeply irresponsible. People are in this work because they care about those who are in there, for whom they are responsible. So I think this also has a very traumatizing effect to be in a position like this, knowing that you are responsible for people who are not in a position to assist themselves. And if something goes wrong, you will be responsible, and you know you're not doing the kind of job you want to do.
Yeah, and the problem is that when we look at those the places that we're talking to, particularly old age homes, there is a massive need to protect them because we've heard how you have to look after the elderly because they are much more susceptible to this virus or this disease than anybody else. Mervin, I'm going to come to you because you're actually from the Seringa Association for the Aged in Port Elizabeth, and basically what you are saying is that you have had to make loans in the past 4 months in order to keep the organization's doors open. Talk to us about this.
Yes, Leanne, that is correct. And also just to come in with Lisa, is that it is right, we are going now into our 5th month of not getting any money from the Department of Social Development. You know, we are running what they call a service center. We are not a residential facility. Let me just emphasize that. What we do is we have a mandate according to the Older Persons Act number 13 of 2006. And if you go and read chapter 3, it speaks about community-based care and support programs. Now, that is what we are providing to the older persons in the community, is community-based care and support, which means that what we are doing is we try to let the older person stay in the community for as long as possible. And what we do is we support them with nutritional care. We support them with basic nursing care and with active aging to keep them active in society for as long as possible. Now, understanding since the announcement of the lockdown that older persons are not allowed to come out and to be part of these clubs that we have all over the metro. So what's happening is that they have the Department of Social Development in the Eastern Cape has just unilaterally decided that they will not pay anything. No consultation whatsoever with any of the service centers or any of the people in what they call Program 2 to say this is the way forward because of ABC, we are going to do this, that, and the other. So we are in this dire situation. As we are speaking, yes, you are absolutely right, Leanne. We had to borrow money just to keep the lights on of our facility. Remember that even though we are not a residential facility, we have an office, we have facilities, we have rental equipment, we have rent to pay and all those type of things, telephone accounts and all that. At the beginning, I know they were talking about possibly paying administrators to cover these type of costs, but nothing has been forthcoming from the department. So we are in almost at a position where we will lose our facility because there is no payment whatsoever. Also, not only not payment, there's no communication from the department, no emails, no WhatsApps, no SMSs, nothing. The department, they just don't care. And we thought all this time, no, we are partners with the department because the department always say that the NPOs are the extended arm of the government. That's a lie. That is a lie. We are not the extended arm of government because they don't care for NPOs. Lisa has touched on a few things. One of those are salaries. I mean, that not that that is the most important thing, but we need to pay our workers, which we can't do. Yeah. And also, we are not in a position to provide these nutritional meals to our beneficiaries. Seringa has 305 beneficiaries, older persons over the age of 60, which we provide service to, but we are not in a position to do any of those things since the department has just decided, hey, we are not going to pay you at all.
Yeah. Lisa, I'm going to come back to you here because I'm almost struggling to understand how this is possible. That what you're saying in some of the provinces, they've just cut all payments or subsidies without any explanation. There was simply no payment made, no communication, nothing. Is this what I'm understanding at a provincial level?
Yes, in some provinces they received a circular saying, we think you haven't been working. The department didn't even check what organizations had been doing. We've decided you didn't work under lockdown, so we're just cutting your subsidies. Now, I would argue that that's illegal because organizations, and this applies in the Eastern Cape to centers like Mervin's, they have already signed contracts back in April for a particular amount. The department to unilaterally, 5 months later, decide you cannot have that amount anymore. In fact, you're going to have to throw away that contract and sign a new contract for the lesser amount. That is very, very coercive because they're saying only when you sign that contract will you get your money. Now, they've already signed contracts, so quite clearly there's something very strange going on there. There's also, I think, the situation, so for instance in Mpumalanga, because they just unilaterally cut the subsidies, the organizations have had to cut staff's pay. So that is another thing that from a labor point of view, is how the department pushes organizations into doing things that are highly undesirable. But they also sit in a position where, because the economic situation is so bad, they can't turn to their usual community fundraise. And also the establishment of the Solidarity Fund has meant that many companies who work with them have said, I'm sorry, we can't give to you, we're giving to Solidarity Fund. So all the other possible sources of income where organizations have gone to have dried up. And now you've had the department at this very difficult time, unilaterally, without consultation, cut the money that is due them. And the thing that the department forgets is that the money is not actually for organizations. Organizations are a vehicle. The money actually is intended to go to services. So when they cut the service, they're actually doing beneficiaries a disservice. And that, I think, is really our concern, is the way in which the beneficiaries of services are being forgotten in all of this.
So, Lisa, what I need to ask you is if you're privy to any figures and numbers from these organizations that you're talking to, especially those of the care facilities, if it be the old age homes or anything else. There was figures that I'm reading from a month ago that was saying, and this is from the Department of Social Development, saying, this was 1 month ago, so I'm sure they're outdated, perhaps there are more recent figures you have. They're saying that there were about 35 deaths in these care facilities, but figures from from the care facilities are very, very different, and saying that there's a massive difference. They say 35, but the actual figures are sitting higher in the thousands. But perhaps you know more. What is it looking like?
That we haven't been able to assess, but the situation is extremely difficult. The Association for the Aged, for instance, which runs a series of facilities in KwaZulu-Natal, for example, has had a COVID-19 infection. And they were saying how difficult it was because all of their facilities are not supported. So they had to spend up to 300,000 Rand in order to pay for deep cleaning and disinfection after virus, laundry, etc. They haven't received support for that. So they're an organization that is now by the end of the year, going to be running at a 30 million Rand loss. I think that's what concerns us, is that what is at stake here is the future survival of social welfare or care services in South Africa. They need to be helped to make it through this period so that by the time the lockdown finishes, we still have social care services in some kind of quality state left at the end of it.
Yeah, I mean, this is a Life Esidimeni tragedy waiting to happen, if what I'm understanding is correct. Mervin, I want to come to you because you're obviously hands-on. You have one of these organizations. Have you had infections within your care facility? Have you had any unfortunate deaths that have taken place? And how have you handled it? I mean, in terms of PPE, I know you gave us a little bit of the situation. Perhaps you can delve a bit deeper for us, what it's been like for you over this time.
Unfortunately, we don't, as I said earlier on, have a residential facility. We had a few deaths, yes, but it was not related to the COVID-19. Remember, we work with older people, some of them as old as 95, almost 100. So there's natural causes and all that for deaths. But fortunately, we were not tied down with any of these corona-related deaths at our center.
That's at least something that's positive in this. Perhaps maybe this is what the Social Development Department are going to say, that they have to, their focus now is on fighting COVID-19, and that's why you haven't perhaps gotten extra additional funding from them. Could that be an argument?
There was a break in the sound, Leanne. I didn't get that.
What I was saying was that perhaps the Social Development Department will be saying that their focus right now is on trying to alleviate the plight of coronavirus, and that's why you are not seeing as much assistance coming towards you.
No, I understand that, yeah. However, it is this thing about having to still provide service to the older persons. Remember what I said earlier on at the beginning, that our services are part of a parliamentary act. It is mandated by the Older Persons Act. So it is something that we still have to do, because older persons fall under the most vulnerable of people in our society. So we still have a responsibility to take care of our older persons, whether it be in a residential facility or whether it be in society as a whole. There's still a big responsibility on government. And just to emphasize that the Department of Social Development has said that these services, community-based care and support services, will in fact have preference, according to their own statements, preference over residential facilities, because they want to take care of the older persons in the community. But what they are showing us is something totally different, that now we have been put on the back burner, with no support whatsoever, not to say less support or little support, no support whatsoever. We've been lucky. We had some food parcels, not a lot, through the Solidarity Fund, and it is difficult to spread those food parcels amongst all our beneficiaries. It is something that is really impossible to do. Yeah. And then we were also reliant on private institutions that came on board with some food parcels as well. And as I said earlier on, we had to borrow money also from private institutions to at least keep our lights on. So there's a devastating impact on us as service centers to provide these services that we are supposed to do to the elderly.
Yeah, Mervin, how many elderly people fall under your domain? The number I've got in front of me is around about 305 elderly people that basically through the association are looking after, having to feed and the likes. Is that the number around about?
That's correctly, and I can also say that it's been cut every year. We've close to 400, but once again, it's one of those things that the department decides in their own wisdom that every year they are going to cut these numbers down. Yeah. Last year we had 353, and this year when we started out, they just said, okay, we are going to cut you down now to 305, but with our SLA that Lisa touched on earlier on, that is the contract that we have signed. They have decided again in their wisdom that they will cut it from the 1st of April. They will cut it to 250 people. So that is what they just decide to do without consultation, without having to say, Mervin, come, let's talk about this. Let's negotiate figures or whatever. They just decide, no, they are going to cut it down to. So when we have this new contract that Lisa referred to, it will be for a lesser amount. Talking about between 250 and 230, whereas the need is growing. There are older persons that's on a waiting list at our organization that wants to be part, but because of the limited funding, we cannot just allow people in and provide these much needed services that's needed in the community. So every year it's been cut down. Leanne. So when we go in now again to the department, we are looking at about 250 to 230 people.
Yeah, that's heartbreaking. And as you say, there's so many more that are in need of this. Lisa, I'll leave the final word with you. Unfortunately, we've run out of time, but we hear that the department has received the report. This is what we are understanding. They didn't want to come onto the program as yet. They say that they are looking at it and that the issues are being addressed. That was their response to us. What's your response? I mean, have they acknowledged it to you? Have they given you any feedback at all?
Yes, in fact, we had an extremely constructive meeting with them last week on Thursday with National, and I think we've put together what will hopefully be quite a concrete plan to deal with the immediate crisis. But there are a series of whole much longer-term difficulties that need to be sorted out. So the National Department showed themselves very open to that. My concern is that it's quite clear in the months that we've been trying to talk to National to do something about this, that some of the provinces even ignore National. So we're seeing movement from National. Some of the provinces remain really problematic.
Well, let's leave it there. Thank you so very, very much for talking to us. I have no doubt that the department will speak to us when they are ready. They are always open to that conversation, but it's the provincial ones that we're very worried about. And Lisa, that's what you're bringing up as a major concern. Lisa Vetten is from the Care Work Campaign, and Mervin Rossouw from the Seringa Association for the Aged. So thank you very, very much for talking to us here on the program. Not only is it the elderly, it's also the children's homes as well as shelters for women that are on the brink of collapse because they have not received state subsidies for 4 months now. Let's take a quick